in fact, the inmates themselves have a sort of a colloquial way of referring to themselves, and they actually distinguish between inmates and prisoners, meaning the prisoners are the people who haven't really accepted that they're there. They're in a prison, whereas the inmates are members of the community that recognize that they're there for the long haul. So it's actually sort of an interesting thing. And you know, one other point that I'm gonna make that just sort of gets you to understand the biases that we bring into the correctional system. One of our tougher camps, it's a maximum security institution, is Union Correctional Institution. And I was very surprised when I got there that the squirrels came directly up to the inmates. They weren't afraid. And I finally asked an inmate, how is it they were able to get them to be comfortable? And they said they never learned not to be comfortable. It's second, third, fourth, fifth, 10th generation of the little creatures, and they've never learned to be afraid because they've never been harmed. And so they will literally, as you're sitting there, walk right up to you, eat off your plate. It's just sort of an interesting perspective. So with that said, the next slide, and my first slide, is a quote from Dr. Osler, and I think it's a perfect one. It was actually given to me by my boss, which, by the way, please make me look good because my boss is in the audience here, Dr. Pages. He is Florida's statewide director, and this was a quote that he gave me, and I think it's a perfect one. One of the first duties of the physician is to educate the masses not to take medicine. And that's a pretty significant statement. The answer to medicine is not actually always medicine. And for those of you who are not familiar, although it's a very common name within the medical community, Dr. Osler is considered to be the father of modern medicine. Things that are obvious and taken for granted now were actually incorporated and introduced into the medical system because of him. For instance, he was the very first professor of a medical school that actually took the medical students out of the classroom and brought them into the hospitals and on rounds with him so that they could observe firsthand the things that needed to be taught that you can only learn by experience, as we know. So the point that I'm making is that he, being the father of modern medicine, would be the very first one to incorporate holistic treatments into the care of your patients. Because as we know, in dealing with stressful patient populations, holistic treatments really can affect a significant change in terms of their overall prognosis and their overall outcome. Alternative treatment modalities. So when I was asked to present on this as a traditional physician, I immediately panicked. And I thought, what do I know about this kind of stuff? Do we even have these things in the prison? And so I started to research it very quickly. And then all of a sudden, as I started to read through it, I realized I actually did know all of these things that we have in the system. I just didn't actually call it and label it as such. But all of the things that we're about to describe to you are actual programs that we have in Florida through the Department of Corrections Mental Health. So the things that we're going to be discussing are self-help group therapies, diet and nutrition, faith-based programs, animal-assisted therapies, my favorite, expressive therapies, horticultural programs, and stress reduction therapies. And then if we were able to quickly scramble on the slide at the very end, we have a special treat for you regarding stress reduction therapies. So self-help groups. So I think that this is one of the best treatments that can exist, because many of the things that we take for granted as members of our society are not shared experiences that the inmates have. They've never learned how to self-care. They've never learned how to self-soothe. And this is not a judgment, it's just a statement. Many, not all, but many of the persons that end up in the correctional system have never had perhaps a parental figure or a guardian figure that was teaching them how to self-care. And so this actually takes ownership of the issues and the problems that they're experiencing and puts it back onto the individual itself, which is a really great concept for our patient population, our specific patient population, because as many of us know, they really have a challenging time taking ownership for the behaviors that have brought them to this point in their lives. And if you don't take ownership of those behaviors, you can't affect a change. That's the only thing that we really can control. You know, I often say to my patients, to my inmates, because I don't know what your experience is in corrections, but I actually have never met a guilty person in prison, that it was actually there because they committed a crime, which, you know, you think just by random chance that the justice system would get it right at least once, like one time, a guilty person would actually end up in prison. But no, each one, I didn't do it, it wasn't me, I wasn't there. And I sort of say that tongue-in-cheek because I'm very confident that, for the most part, our judicial system did, in fact, get it correct. But that simple statement of "it wasn't me" shows you, again, that they're not taking ownership of their behavior. And if they're not taking ownership of their behavior, then how can you change something that you didn't do? And so one of the things that we can teach them in these self-help groups, and that they take various forms. One group that's run at one of our institutions is an Alcohol Anonymous program, or a drug treatment program, where a sponsor comes in, either approved, of course, by the Department of Corrections, or someone within Centurion is willing to act as a volunteer group leader, and helps to create a group therapy environment for them to sort of express themselves. So that's, again, it's just a very important first step in teaching someone to take ownership of their own behavior and their own responsibility for their behavior and the consequences thereof. Because if you don't take ownership, you can't make a change. Diet and nutrition. As I take a sip of my Diet Coke. As we know, as healthcare providers, as professionals, you are what you eat. So in terms of, as best they can, taking control of their diet and making healthier choices really can help them in terms of their overall outlook on life and their overall feeling of wellness. Many of the prisoners have sort of been living hand to mouth on the outside, and this is the very first time in their life where, as sad a statement as this is the very first time in their life where they've actually had food, shelter, clothing as a secure, as something secure in their lives, versus in the outside where they were scrambling to find shelter, to find food, et cetera. And so teaching them how to eat healthy and to make healthier choices can really help them in terms of their self-esteem as well as their overall physical wellness. Many of them are, as we were saying in the beginning, are diabetic, have endocrine abnormalities, have cardiac issues, all, as we know, all factors that are contributed negatively by a poor diet, by poor health factors. And so teaching them, again, the things that we simply take for granted, how to eat properly, how to take care of ourselves, really can make a significant difference in terms of their overall wellness and prognosis in terms of their long-term care. Faith-based programs. This is a great program that we have in Florida that I really, really enjoy, and it's something of an honors program, so to speak. And by the way, I'm so sorry if I am only speaking about Florida, but that's honestly my only experience in terms of correctional care. So I'm sure that, as we hear, many of the other correctional programs throughout the country have similar programs and are working just as hard as we are to provide the services that our patients need. So I don't mean to say Florida to the exclusion of anywhere else, but simply that's my experience, Florida. Obviously, Virginia as well has, and Iowa as well has these programs. So faith-based programs. where you have to exhibit a good behavior for at least a 2-year period, and you have to be referred into the program, and then it is a spiritually run program. There's no specific religion that is at the forefront, I would say, and all religions and belief systems are respected, but it's an honors program, and it really helps them in terms of how to connect to their higher power, so to speak. One of the prisons that I worked at, one of the institutions that I worked at, they actually had a Native American run religious faith-based group that was a subsection of the main one. And so any religion is represented, any religion is respected. Muslim, Jewish, Christian, obviously, that's usually the predominant one, but they have a sense of freedom to express themselves, which is very important. Now this is my all-time favorite program. And I actually first experienced it at Tomoka because, again, you're in a prison. It's a maximum security prison. And you're walking around, and all of a sudden I see a couple of dogs trotting by. And I think, are they supposed to be here? And they said, yeah, no, they're allowed to be here. And so that was my first entry into an animal-assisted therapy program. And it's a win-win on so many different levels. So many of the shelter animals that have been abandoned throughout the community, wherever the institution is located, are in connection with the prison. And whenever there's an eligible animal, they're brought to the prison. And there is a group of prisoners who have to take a special training and are under the supervision of an officer who has experience in the area, and they actually will shelter the animal, housebreak the animal, teach the animals to follow commands, to obey commands, which again, if you think about the patient population that we're dealing with, they tend to have a little bit of problems following rules. And so sort of see one, do one, teach one, not in any way to compare them to an animal, but the comparison being that they're learning that we follow rules. Things have to be obeyed. Officers have to be obeyed, instructions have to be obeyed, and these are tools that they're not necessarily have incorporated within themselves, and by teaching to others, even a shelter animal, it really sort of hones in the point. And I'm a firm believer in touch. In order to connect to another human being, there has to be that feeling, that touch, that connection. And so, and I'm sure many of us have experienced during these very trying times with the pandemic, when we're not really allowed to physically touch someone else, and it's all about social distancing, that can be very depressing and very isolating. So if you magnify that by 10 with prisoners, in prisons, really, we don't want them touching. We don't want them touching us. We don't want them touching others. And so it's sort of a catch-22, because if you think about it, once a prisoner has entered the prison, they're not allowed to touch us, of course. It's frowned upon that they touch each other, and yet they need, in order for emotional wellness, to have that connection, that touch. These animals provide that. I have seen even the most hardened of inmates, prisoners, that just melt into tears when caring for the animals. They learn to love something, they learn to care for something, they value it, they value life, they value the connection that they have. And so it's just a win-win situation for everyone. The community wins because there's a place for these really very sad animals that have been abandoned. And the inmates become very protective of the animals. They don't ever want them mistreated. They want them to follow the rules. That's their connection. That's their loved one. That's their significant other. So I've seen cats that are simply roaming around the prison free. And again, if you think about it, the animals that are there, second generation, third generation, fourth generation, and so forth, have never learned fear. So it's almost like a Disney storybook movie where these squirrels and creatures come right up to you, eat right out of your hand because they've never known fear. There's never been a problem. And so I can't emphasize enough how much I love this program, and I can't emphasize enough how important it is to have that connection, that touch, that feeling of caring for another being that's just really can be life-altering for them. Okay, expressive therapy. Many of our prisoners, and again, I don't mean to criticize, but they have had certain challenges in appropriately expressing themselves. Let's put it that way. And so this is an outlet for them and a creative outlet for them that allows them to express their feelings. I mean, we all know the benefits of art therapy, particularly when dealing with children or when dealing in a traumatic situation. Art therapy can absolutely help to express your feelings, your thoughts, your inner concerns, and I've seen the most amazing things that these individuals create. And many of our prisons, most of our prisons, in fact, they have these beautiful ornate murals that have been hand-painted by the inmates. And the creativity that they use to get resources, it's just amazing. I've seen an entire flower bouquet, and I don't mean a portrait, I mean an actual flower bouquet that was all created with tissue paper, toilet tissue paper, and food coloring. And you'd swear that it was a blooming rose. You'd swear that it was a green stem. And so it's beautiful and very creative how they are able to, I say to them often, if they only use their powers for good instead of wrong, they could really just make such a difference, because the creativity that these individuals have, it's really an untapped resource. It's amazing. So it's therapeutic, it beautifies the environment, and most of our wardens are very sensitive to mental health issues, I think because our statewide director of mental health and Dr. Pages, our psychiatric director, really emphasize the importance of it. And so they'll do everything that they can in terms of safety and protocols to allow for these programs to take place. So it's just really an amazing thing. Horticultural programs. So again, we have the most serious prisons, the maximum security prisons with the most violent of offenders that have programs such as this. Again, all warden approved by the Department of Corrections, otherwise it wouldn't take place, where they have their own gardens, many on a large scale, where they can actually produce massive amount of produce, and other simple small tomato gardens. Or at Wakulla, there's a small garden right in front of one of our dorms that has a small patch of tomatoes, a small patch of berries, a small patch of, I want to say cucumbers, but I'm not really sure if it's cucumbers. But just their, again, it allows them a healthy and effective way to be outdoors, to be contributing, to be creating. And so these are just wonderful, wonderful programs. We're very fortunate to have them. And with stress reduction therapies, I think I turn it over to you.
Good morning. Thank you for the introduction, Dr. Greenfield, and it's going to be hard to follow the other Dr. Greenfield.
I'm Dr. Greenfield 2.0.
Yeah, 2.0. Big G, little g. Anyway, my name, again, is Jennifer Elder, and I'm representing the Virginia Department of Corrections. Let's see here. Oh, they took out my first slide. So originally, my partner, a sergeant at Fluvanna Correctional Center for Women, was supposed to brief and focus on his security perspective of the wellness programming that originated at Fluvanna, but he could not be here. So I might be speaking a little bit for him because his experiences really give such good perspective on the change and maybe the culture and experiences like that. So our mission as for the department is we're in the business of making people be better, giving them those tools, giving them the support, and encouraging a holistic environment, a healing environment. Very inspired by our director. So in 2018, I came to Fluvanna as a volunteer yoga instructor. I was in my first career. I wanted to do some community service, and I started teaching there and noticed something with the women. The disconnect that they had with their mind and their body, and how much trauma that they had gone through in their lives. So I started doing some research, and I started volunteering more. And with the support of administration and the wardens at that time, they allowed me to pilot some programming, and one to include yoga as a mindfulness-based practice. And that's mostly what I'm going to focus on here, and also, again, flavor in some security perspective. So the wellness program, again, piloted at Fluvanna, I wanted to focus on the main principles, the guiding principles, and focusing on the female population, realizing that the females are very different than the males. So in keeping with the rest of DOC, definitely what was important was collecting data. Data-driven model, so to show and to explain the impact of before sessions and after sessions. So immediately I wanted to make sure we had the evidence, in our facilities to share, and come together with other like-minded programs, other states. So I implemented some health surveys based on some mental health and just health services, a pre-survey, based on how's your sleep doing, your anxiety, your depression, and pain scale, things to that effect. The other thing I wanted to make sure I focused on was that the experiences of females are a lot different than males. Females have and strive to provide, services. We react with our emotions. We have different needs. And so to recognize that and to be responsible for that and supportive of that, that's just something we want to always keep in our mind. And I'll go more into that when I talk about how I teach the yoga at a female facility. And as far as trauma-informed or trauma-sensitive, just encouraging and incorporating the research on the violence against women and the impact of their trauma generationally, understanding where it came from, and again, giving them the tools to help kind of unwind or untangle, what happened, and not just how they're reacting, but what happened to them in order to get to that point. And relational. So females are more of social creatures built on relationships, and yoga actually means to come together. It's derived from a word yuj, and it means to yoke. So we've been talking about connecting, and that's what I was thinking when Dr. G was speaking, was a theme of connecting. And so what better way to connect in corrections? Okay. Okay, so this is where my partner, Sergeant Drake, was going to share some stories. He's been with corrections for about 16, 17 years, and he's a strike force commander. He is also in the training department, so he models and guides new officers in training as they come through. So one of the stories he shared with me, or us, actually we presented in February at the ACA virtual conference, and we did receive a lot of really positive feedback, and that's why I wanted to continue with his stories. And one of them was about there was an altercation in one of our housing units, and he was actually on post and master control, so he could see the video and what was going on there. And he noticed that, and this was before COVID, he noticed that there was a group of yoga practitioners who had their chairs and also some mats or towels out on the floor. And he was just watching, taking notes, and seeing what was going to happen. He noticed that, and the altercation wasn't within the yoga students, it was like in the day room, but the yoga students were on the other side. But what he noticed was when the altercation broke out, instead of the yogis or the practitioners participating or egging them on or instigating, he just noticed very smoothly they just removed themselves to the side. They just observed. And that's another piece of yoga, is it helps us become an observer instead of, the instigator and such. So he was kind of blown away, and when he shared that, it really made me, go, oh, wow. So that's an example of shifting a culture within the inmates. And as you know, in corrections, shifting a culture is nearly impossible. But having little lights like this and having examples like this really shows me, and hopefully shows others that are observing, that we can shift it. So another example that he shared was with security staff. So during COVID, as we all know, we played, if you were on site in a facility, I can only speak from my experience, and I played a lot of different roles. I wasn't a yoga teacher. I was doing food service and cleaning and everything. So everybody it was chaos. So our 2 watch commanders, they probably make 100 to 200 decisions a day at least. So I was walking in, I got my keys, and I just noticed that, they were just frazzled, and I said, hey, do you want to do some breathing? You want to do some yoga? They're like, no, I don't want to do any of that. But I said, all right, just give it 5 minutes. Let's just close these doors. Let's just breathe. Put your feet on the ground. And, these are guys that, I just asked. So worst they could say is no. So they actually did the breathing exercises with me. And they closed their eyes. And they sat up straight. And they took a cleansing breath, which I should have done more of before I came up here because I'm nervous. And they settled right in. And how is this, impactful? What made this a perspective? Well, Sergeant Drake, I was done with the class, my little mini 5-minute watch command class, and I went on the yard, and he was in charge of the yard. That was his post that day. And he's like, hey, Miss Elder. I said, I just taught yoga to our watch commanders. He's like, oh, that's cool. He went in, he got a radio, did whatever. I saw him later, and he said, you know what? What? And he's like, the whole energy shifted today on the radios, on decisions, on direction coming from the watch commanders. So he noticed it, and then it was a really cool thing. And I went back into the watch commanders and I said, hey, how do you guys feel? And they said, will you come back in the morning tomorrow? So that was as simple as it sounds, and it was impactful. And also during COVID, I started, instead of being able to be in person with the programming, I was permitted and encouraged to make announcements over our PA system, and we have about 1,200 inmates and then 400 staff, maybe less. And so I was encouraged to make some mindful moments on the PA system. And so instead of me being able to connect in person, at least they could hear my voice. And I could give them tools to, be present and take a moment and, become grounded. So that was a really, creative way to cope with COVID in corrections. And yeah, I just used 4 C's right there. So I'm very proud of, just these little bits of culture change, whether it's the inmates or the staff. I didn't tell you what yoga was, though. And I'll tell you what that is. So when I teach any level, I always start off with what yoga is, and it's based on the 3 B's: the brain, connecting the brain, the body, and the breath. And so hopefully, as the breath moves the body, we start to rewire the brain, and so we start then to change our patterns, our habits, become more centered and focused. And that's the mind. And physical benefits, include reduction in stress, weight loss, lowering blood pressure, all of the things we can Google. But it's a holistic approach to helping a population and the ones that support it, to be productive and healthy. Let's see what else. So part of my experiment, my piloting of these wellness programs, I started a permanent yoga program based on all levels, whether it's wheelchair-based yoga, yoga for beginners, yoga for correctional officers. I started teaching to the staff. And it just became kind of like a wave of okay, I just want to see what this is all about. So it did become really impactful, and people were starting to feel and also see the benefits. Also, I piloted a yoga teacher training, which included a 250-hour curriculum geared toward female inmates. And as you can see, some pictures which are very impactful because twisting my words. But it was definitely life-changing, I know, for them, but also for me, to be able to witness the change in attitude, in their bodies, in their choices. And there's one of these students I'm looking at right now, and when I met her in 2018, she was always getting in physical altercations and fights and agitating and instigating, like those folks I was telling you about in the other housing unit. And after the program, and it was a very intensive program, evenings, homework, weekends I came in, she didn't have any altercations. The reduction in her charges or incidents or whatever you all call them, it drastically decreased. And that's just one example, and I just saw her up there, and so I just wanted to share that. So they're actually certified, or it was a certificate-based program. And so out of the 16 inmates who I graduated in 2019, some still reside at Fluvanna, some also, some have transferred to lower security facilities, some have been released, and one, I think, transferred to a federal institution. Since then, either they've started their own mindfulness workshops or groups within their housing unit, or they've contacted back, to me, their teacher, of how to start a program. So it's, it is the ripple effect. It goes back to what yoga means, and it means to connect. So I'm very, very proud of that. Also, we gave, that helped us with our job program. We added more job opportunities. So as far as wellness support and yoga instructors. And then our physical therapy and our health services and mental health staff, they realized and they saw how much this really did help their way of doing things. And the physical therapy director and I, we have a common phrase of movement is medicine. So again, just complementing those other modalities of healing, and you got the benefits. I'm so sorry. So instead of me paraphrasing some of the feedback that I've received and administration have received, I wanted to share a few, I think, of the most impactful testimonials or parts of testimonials that have come through, at least at the women's facility. Yoga makes me feel like I have a life worth living. That's a really, short phrase, sentence, but that's powerful. That's very powerful. Yoga sets me up for the week. I feel like I found some peace and purpose again. Feeling in order to heal. That's another one of my phrases I use. That going back to that disconnect of the body and the mind. When we start to reconnect and do tools to help us do that, you start to feel again. And what I remind the women is it's okay to feel, and it might not be comfortable, but it's okay. And you're in a safe space, and we'll go through it together. When I started yoga here, another quote, I was one of the first ones to try it. I was already 10 years in and having panic attacks almost every day. Yoga helped me breathe again. I look forward to it every week, and now I use it every day. And this just reminded me of some conversations I just had during COVID. So what does this look like during COVID? Well, I told you that I had the opportunity of, speaking over the PA system. But I received a lot of testimonials from the practitioners that, have been on minimum movement because of our pandemic. And a lot of the feedback is, you can do yoga anywhere. You can do it when you're standing for count. You can, breathe when you're waiting in any kind of line, when you're waiting for medical, just very different things. And I will say that, what has helped you through this pandemic, and a lot of the feedback majority would be, tools like this. I came off all pain medications, lower back pain for her sciatica when I started weekly, and then a daily yoga practice. And she was incarcerated for 20 years and would never have enjoyed this life without it. And I know for a fact this lady was released back into the community, and I believe she started, teaching yoga to a mom's group in the neighborhood. So just being able to share her experiences was really impactful. And one more story, and this was from Sergeant Drake. I was teaching a class in the gym, and just a big group of women, diverse sizes and backgrounds and everything like that. And there's this one lady that's incarcerated, and she's been in a wheelchair for over 10 years. And she was, just there to observe the class. And I said, hey, do you want to try to get down on the mat? Or we can use a chair or a tool. And I had a lot of props in order to best support her. And she just argued with me. I was like, I don't want to. But I could see, maybe she would. And I didn't push it. But she, with some help, got down on the yoga mat and out of her wheelchair for the first time in 10 plus years. And it was extremely emotional, but also such a, rewarding win for her. And to see her, being physical and being able to allow others also to support her. So that was a really cool moment. And from there, she continued her physical therapy, and she talks about that all the time. And I bring Sergeant Drake into it because he was the security, watching over the class. So that was another story that I wanted to make sure I told. And what did this look like during the pandemic from the inside? Well, I already shared the opportunity to brief on the, PA system, but also I added on some wellness packages and wellness packets and reminders of, how to do sequences and how to breathe, and just reminding people to breathe. Mindfulness is your ability to focus on one thing and, just keeping it simple and bringing them back, whether it's a journal entry, whether it's walking one foot in front of the other, or whether it's taking 1 or 2 breaths. So I think the only thing I didn't add was the wellness packets. Also, later, we're also briefing a wellness channel briefing, an initiative also under Virginia Department of Corrections. And that's an alternative method that we created and piloted this past year. And since I couldn't see my students in person, I recorded, or I was one of the folks that was recorded, and so they could see us on the big screen. But we'll get into that later if you want to come back at 2 o'clock. Let's see. What else did I forget? That's all I have. I think that one is next.
Me again. So again, this is not my slide, but I'm happy to present it. Potential strategic plan, subjective versus objective. Strategic timed surveys, rating scales, physical pain, quality of life, psychosocial wellness, and anticipated continuation. And I think really what that is just simply saying is that in order to help the individual connect and make a change, we need to have sort of a real tangible scale that they can use sort of as a biofeedback type of system. But it helps, all the things that we're talking about help in terms of their quality of life, the degree of pain that they feel, and their psychological wellness, and to it can be quantified on a rating scale to show that. It will objectively be reflected in the medication records, in I'm assuming positively, in the lowering of disciplinary reports, program compliance, and recidivism rate. Because if we give the inmates, the prisoners, the tools to succeed, the coping skills to succeed, hopefully, and the resources to succeed, hopefully it will reduce our rate of recidivism, which makes perfect sense in terms of what we're doing. And so now, this is what I was alluding to earlier. We were sort of on the fly discussing it. I sort of wanted to end my slides with this beautiful, peaceful scene, but we are actually impromptu going to be given a very brief, unrehearsed guided meditation. So again, we'll return it back.
Surprise. Ready for it? I won't hurt. So this is very similar to what I taught in that watch command office. All right. So I invite you to just sit comfortably in your chair. You don't have to do this. You can do it. It's okay. But maybe move yourself back, I don't know, just a few inches, just so you have the space not to lean forward or not to lean way back. Yep. So sit in an upright position. So all we're going to do here is we're just going to do a grounding exercise using your feet, your seat, and your hands. So if you're comfortable, you can close your eyes or maybe just gaze softly in front of you. And let's just take a breath together. So take a deep breath in and then a slow, deep breath out. I needed that. So we're going to focus on your feet first. Just feel into your feet from the inside of your shoes. Just start to press down and actually make contact with the soles of the feet and the inside of the shoes and also with the ground. Begin to lift the front of the feet and the toes, just the toes. Wiggle the toes, the pad of the toes. And then just notice how the added pressure increased with your heels. So just go back and forth as you sit. Just press down on the pads of the feet and the toes, and then shift the weight back to the heels. Just noticing the sensations that's going from the front and the back, continuing to breathe, connecting with the floor. And also notice the sensation if you're wearing socks or if you're not wearing socks, what's touching the ground. And just let your feet and your ankles be heavy. Allow the weight to just ground you. Continuing to breathe. And exhaling deep. And just feeling grounded underneath the feet. And now notice your posture in the chair. Notice if you're slouching forward or slouching back. And just bring the awareness to what is touching the chair, your seat, your bottom, your back, your shoulders, depending on your height. Just bring that awareness to the body and the parts that are touching the chair. The back of the thighs, parts of the back. And ever so slightly, just try to just lift the spine, just so you have a long spine, good posture. And take a breath here, in and out. And maybe shift the weight left to right, just to notice that maybe you were sitting on one side, sitting on another. Just try to allow the weight of the body to sink down with the natural pull of gravity. And just grounding, stabilizing, holding you steady, just like your feet. Noticing that connection and breathing. And now with the hands, notice if your hands are clenched or if your palms are sweaty. Maybe drop your hands and your arms to the side of the chair and just let that gravity help you. Relax. Relax the shoulders. Keep breathing. Soften your hands. Just allow the palms to be exposed. Maybe your palms are on your thighs, and that's great too. Just feeling that connection between your hands and another body part, or maybe they're grazing against the chair. And try to soften a little more. Just breathe as the mind quiets down, or if it's racing, that's perfect too. Just try not to attach to it. Just try to relax in the body, the face, the jaw. Just take some deep breaths, lengthening through the spine, grounding through the feet and your seat. And let's take a few more rounds of breath just to help that central nervous system set us up for the rest of the day. And then I invite you to think of one thing that you're grateful for right now. Just say it to yourself as you take an inhale. And then as you take your exhale. And then maybe tonight you can do that same grounding exercise and then remind yourself of what you were grateful for when you started your day. I should have done that first.
Thank you. That's the end of our presentation, but of course, if there's any questions, thank you very much. Thank you. And that really was spontaneous, but what a great way to end. What a fantastic way to end.
Thank you both very, very much. For those that are joining virtually, I will say we have had some IT issues connecting our platform and YouTube. It shows up on this iPad that there's no questions in the chat yet. I don't know if that's true or not. But I just think that this was an unbelievably important lecture for a lot of reasons. For those of you that joined later, I am the other Dr. Greenfield. We have Virginia, Florida, and Iowa. And even though I think we represent probably three very different states, I think at the end of the day, we could compare our populations in those three different states and see a lot of similarities. Just for some information, I am a psychiatrist as well. I practiced 25 years in the community before I decided I needed a change, and a change I got. I went to a brand new women's prison outside of Des Moines and became the sole psychiatrist there for 800 women. And it was very eye-opening. Fortunately, or unfortunately, I would say, that one of my former patients was incarcerated there, so she spread the word that he's a really good guy, so you could tell a lot. So that really helped me to kind of fit into the population. But I saw something there every day that was concerning. 80% of the women that entered the Iowa Correctional Institution for Women, 80% were on psychiatric medication when they came in. And every time I saw a new patient, I saw the same thing. They had horrible trauma. They most likely had some either untreated attention deficit disorder or some type of possibly even traumatic brain injury. They coped by using methamphetamine, especially in Iowa. And finally, they were probably misdiagnosed with some type of severe mental illness. And now they are all wanting medicine. And so many of these men and women in Iowa, and I'm sure elsewhere, they just don't know how to cope without the use of some type of substance, be it meth, heroin, or Paxil, Prozac, Depakote, lithium, something like that. But it was interesting being a correctional psychiatrist in that people had 15 to 18 months or 15 to 18 years, and after about 6 to 8 months, someone said, you know what, I'm not sure I need this medicine anymore. And it was really interesting to see what are the things we could do as a correctional psychiatrist that would be non-medical. And just a couple things that we've done in Iowa that were really interesting. One was biofeedback with the psychologist. They use a little tool like a clothespin that goes on their finger, and they have this visualization on a screen of what their pulse is, and they can actually feel then that maybe I do have control of my body. And for some of them, it was great. Others would say, I want Klonopin, or I want Xanax, give me a benzo. But for some of the ones that did it, I would highly recommend a biofeedback machine. They're cheap, they're effective, and for a good portion of the population, they work. And probably two of the greatest groups that we had were the STEPS group. Are you familiar with STEPS for borderline personality? Acronym for, I always forget it, Systems Training for Emotional Predictability and Problem Solving, STEPPS, founded by Iowan Nancy Bloom. And then in our men's prison, we've resurrected the old moral recognition therapy, where they really have to have radical acceptance of what they've done that impacts other people's lives. Those three things, the biofeedback, the STEPS groups, the MRT groups, at least in Iowa, I think have been a huge addition to our mental health programming. And I would highly encourage all of those. If you have questions, you can talk to me later. But are there any questions here in the audience for all three of us? For instance? Yes, sir.
A couple things. So when you're sending folks outside the traditional mental health route, do you have a referral process to some of these programs, or like maybe they're located in recreation, or like how do you refer them to get into a group like this? And is any of this in your policies or protocols right now, where you reflect this as well? Because we're looking hard at this, at some of these programs ourselves.
Should you guys take this?
So yes, to all of it. The great thing about working in the Department of Corrections is that for whatever it is that you have a concern or an interest, I guarantee you there's a policy or a procedure that fits. And I'm sure it's similar in your state. And the way I explain it to people is if you visualize the Department of Corrections in Florida, at least, again, Florida being my experience, as a skeleton, the skeleton of the system really are the psychologists. They're the backbone throughout the entire state and throughout the institution. They're the connectivity, they're the process by which most administrative and clinical issues are communicated between us. And so the answer is yes. All of these programs that we're referring to have to be approved not only by the Office of Health Services, of which a component of it is our statewide Director of Mental Health, Dr. Ofterheide, who is a legend and obviously very, very much a proponent of appropriate mental health within the states. But then in addition to that, they have to be approved through security and through the wardens. So there's absolutely a referral process and a way of getting these specific programs approved, again, through the warden at your specific institution.
Yeah, two things just came to mind in my situation was, number one, I use the word pilot. That's my biggest secret is, hey, can I pilot these programs and see what they do? No overhead, I'm free. It was the truth though. That's how I got the support. Showing some data, show them that you'll collect data and it's gonna become, a data-driven program. And also, as far as policy goes, I'm actually in the process of writing new policy. So for some other programs that I started under the wellness initiatives, mothering programs, breast milk, lactation programs, dual-assisted births. So those programs, it's kind of cool to be a part of a policy-making process. So all three of those things, whether they're in policy, and you can kind of do an adjunct, and then, or, propose writing new policy, or also just testing and piloting certain programs. And then the other thing I wanted to share was multidisciplinary team efforts. MDT, whatever y'all in your DOCs call it. And that's how I have found the most effective way to send certain inmates to these programs, is come together as a collaborative group and do an MDT and recommend a holistic approach for your patient. Hopefully that answers your question.
Any other? I'll play the role of Dr. Greenfield at the moment. Any other questions out there while we're? No? All right, so then I think we're done. Thank you all for attending, and thank you for your time.
I passed out the evaluations. I only had a certain amount, but they are on the site too. You can fill that out online. So It really helps us if you fill out the evaluations for programming, and that'd be good. Yes, Jenny?
I'm sorry, I had to step out. We had
Sure.
a COVID-related issue, but
Imagine that.
I know, it's the new norm. I wanted to share two quick things, and thank you for having this topic. We are working in a holistic services area in Ohio that combines all the health service areas with religious services and recreation. Just wanted to share one thing we've done, which is created an interdisciplinary referral within our EHR that lets you refer from, like, let's say, religious services to medical or vice versa. We found it very helpful in recovery and addiction services to enlist religious services professionals to advocate for treatment, and to kind of work with various different populations to see if they can be an encouraging force in that. And then finally, for the mental health folks, we've implemented a sensory program using weighted blankets in some of our residential treatment units. We're piloting that to see the impact of that, and like rocking chairs and some other sensory type devices. I think this is very timely and certainly the next steps for all of us in our healthcare systems in getting creative. So thank you for having me today.
Thank you, Jenny. And that weighted blanket issue is very interesting for some with self-injurious behaviors, too. We've read some articles about that unusual yet fascinating intervention.
Yeah, many of us probably know, we all picked them up at Target or bought them for somebody for Christmas when they're on sale. I know people that use them, and I was always like, yeah, I'm good. But it's looking promising in this application. And then the mental health team that's implementing it is tracking to see effectiveness. So we may be presenting on that at the next conference or something.
Great.
To see how it goes. But
Great.
this is just such a good topic that I think it really makes a difference, kind of open up.
It's the stuff we forget about that's out there. We probably all have some of this, but are we organizing it? Are we utilizing it? Are we advocating for it? So I was excited to be part of this today. Thank you all so very much.
Thank you all for coming. And just remember that my boss is here, and I really like my job as you do your evaluations, so.